Healthcare is a widely used resource and is the topic of many conversations all over the world. Many policies and laws have been put into place to help individuals get the treatment they need for the most affordable prices, but it is always a recurring topic with the change of administration happening every 48 years in the United States. More specifically, vaccinations have been implemented to help stop children from contracting diseases that could cause long term health problems and has helped protect many citizens in the long run. Vaccines have been around for hundreds of years, and the smallpox vaccine was the first vaccine to be created in 1796. A vaccine works by stimulating an immune response by exposing a person to antigens produced by a disease, and were created to protect people from serious diseases such as measles, mumps, rubella, cholera, influenza, tuberculosis, and many more.
The rise of social media has caused vaccine skeptics, also known as anti-vaxxers, to spread their views about vaccines on a larger scale. Public concern, both real and anecdotal, regarding the adverse effects of vaccines has circulated since the time of the first smallpox inoculation by Dr. Edward Jenner in 1796. Parents are concerned with things such as the death effects because there have been kids that have been killed from getting certain vaccinations. In one survey, nearly 25% of all parents reported their impression that children were receiving too many vaccines and felt that this could result in weakening their immune systems. Parents worry about the pincushion effect, as current recommendations are for 19 injections in the first 2 years of life. Many of these skeptics believe that vaccines cause autism. This idea began about 20 years ago when Andrew Wakefield, a now former doctor, published an article in the British medical journal called The Lancet, linking the measles, mumps, and rubella vaccines to autism. The paper was eventually retracted by the co-authors due to increasingly strong evidence refuting Wakefield's claims, and he was ultimately delicensed by medical authorities. Despite criticism in the medical field about Wakefield's paper, many people today still believe that there is a link between vaccines and autism. Because of the spread of these views on social media, websites such as YouTube, Pinterest, Facebook announce that new initiatives will be made to help stop the spread of vaccine misinformation on their websites.
As a result of the skepticism of vaccines that was drawn from Wakefield's work, the rate of young children in the United States who are not vaccinated has quadrupled since 2001, from 0.3% to 1.3%. As a result of the anti-vaccination trend, communities of undervaccinated children have risen, which poses a greater risk to the general public. This has led to diseases such as the measles, which was declared eliminated in the United States in 2000, to return in breakouts in states such as Minnesota. Wakefield's anti-vaccine beliefs also contributed to the 2015 outbreak in Disneyland, located in California, which eventually infected more than 130 people. After this outbreak, California eliminated non-medical exemptions from vaccine requirements for kindergarten entry and tightened their compliance requirements. After this bill was passed, vaccination rates rose in California. Current debates over these issues are taking place in a number of states centering on proposals that would restrict or eliminate non-medical exemptions on a basis such as religion, which 47 states have opposed.
Today, the measles have made a return in the United States and is impacting us at a higher rate than expected. Federal health data states that the percentage of children under 2 years old who haven't received any vaccinations has quadrupled in the last 17 years. Of children born in 2015, 1.3% had not received any of the recommended vaccinations, according to a CDC analysis of a national 2017 immunization survey. That compared with 0.9% in 2011 and 0.3% of 19 to 35-month-olds who had not received any immunizations when surveyed in 2001. Insurance coverage and an urban-rural disparity are likely other reasons for this troubling rise. Vaccination prices have risen tremendously, and childhood immunizations are so important they are required for school entry. The full price to vaccinate a child with private insurance up to the age of 18 is $2,192 from $100 in 1986. This is mostly due to vaccinations being very effective in fighting against multiple strands of the same virus. But there are rising concerns for those who do not have insurance and cannot pay for these prices out of pocket. According to the 2016 U.S. Census, there were about 27.3 million people who lacked health insurance coverage. 12% were under 18 years old, 1.4% were 65 and older, but the most uninsured people, making up 86.7%, were 18 to 64 years old, concentrated on the age groups of 25 to 35 and 35 to 44. Over half the people without health insurance were male and had a high school education or less. Due to the largest measles outbreak in decades this past March, states such as New York have taken action to try and control the outbreak as much as possible. Reports from the Center for Disease Control and Prevention state that in 2019 there have been 465 measles cases in 19 states. Before the vaccine for the measles, about 3 to 4 million children got the measles. Among those children, 48,000 were hospitalized and 400 to 500 died every year. Measles is a highly contagious virus that has a serious consequence such as brain damage, hearing loss, and pneumonia. As a result of this recent outbreak, unvaccinated children have been banned from public spaces such as churches, schools, and shopping centers. This ban will be in effect until minors receive the measles, mumps, and rubella vaccine. Healthcare professionals hope to continue to keep the spread of this disease under control until it is no longer in the United States again.
What we would recommend to the Trump administration is that vaccine exemptions should be strictly limited to medical reasons on a national level instead of on a state-to-state level. The anti-vaccine movement has brought back illnesses that have been eliminated for decades and has put the general public as a whole at risk. Certain states require everyone to get vaccinated, while others might not, and this can send mixed messages to people. Implementing a national law will allow everyone to be more aware of the rules surrounding vaccinations. We also believe that vaccinations should be offered to those who cannot afford them through the act of a new bill. This would guarantee the safety of all children and adults who have concerns of not being able to receive the vaccines because of monetary restrictions. With this proposal, we feel as though we can eliminate many of the communities of unvaccinated children, which would lessen the risk of diseases such as measles being spread to the general public.